Have you ever heard of twin babies hiding from the ultrasound? Have you also ever heard of a woman going into the labor room and giving birth to twins without knowing she was pregnant with twins all the while? Welcome back to my channel. Today we're going to be looking at cryptic pregnancy twin. If this is your first time on this channel, please consider subscribing, turn on notifications so you'd be able to get updates when there's a new one. And for my returning subscribers, thank you for coming. Kindly give this video a thumbs up, please. Give it a thumbs up right away. That means so much to me. And I am saying thank you for giving it a thumbs up. Now we're going to be looking at cryptic pregnancy twins, signs and symptoms of cryptic pregnancy twins, and then ways to diagnose cryptic pregnancy twin. So don't go anywhere. Just ensure you watch this video to the end because I have so much to share with you. Welcome back, everyone. Now, monoamniotic monochromic twins can pack themselves behind their siblings and then just hide in one of the nooks and crannies of the uterus, away from the visible eyes of the ultrasound. Now, have you ever heard of a twin backing the brother or the sister, the sibling, and then not being picked up on the ultrasound? Now, that is cryptic pregnancy twins. Now, when we talk about monochromic monoamniotic twins, these are twins that share same placenta, same amniotic fluid. And in this case, they can easily hide from the visible eyes of the ultrasound. Now, in this situation, it is referred to as cryptic pregnancy twins. So yeah, cryptic pregnancy twins does exist. And in most cases, if the mother or the woman carrying this pregnancy is not going for prenatal checks and not being monitored through ultrasound, this can go unnoticed until delivery. During early ultrasound, it is possible to miss a twin gestation. You could go for an ultrasound and you're told you're having one baby. Meanwhile, you were having two, and you wouldn't know if you were not following up closely with your healthcare provider. Now, let me give you a real life scenario. I am talking about someone that was close to me, my late friend. Now, she was pregnant, and all through the pregnancy, she thought she was carrying one baby. Now, it continued until she visited her mom in another location, and then she visited a consultant radiographer who found out that she was carrying twin. Now, what happened was the second baby was hiding behind the sibling. It was a monochromic monoamniotic twins, short form momo twins. So it was really discovered very late, and she developed some complication along the line of the pregnancy, and she died with the babies. So, hey, this can go unnoticed. And that is why it is always very important that you follow up with your healthcare provider very closely in pregnancy, because there are so many things that can go unnoticed early in your pregnancy that could be picked up later in that pregnancy. So, hey, make sure that you are following up closely with your healthcare provider. That pregnancy that you were told was one baby in your first scan, say 6 weeks, 10 weeks, 12 weeks, might end up becoming two babies at 20 weeks. And if you felt like, oh, I've done my first scan, I don't need to do any other scan again until delivery, you might just meet a shocker in the delivery room when one child comes out and then you were feeling serious contraction again to bring forth another. And surprisingly, I've read about triplets cryptic pregnancy. Yeah, triplets going unnoticed until delivery. But most times in these cases, it has to do with negligence on the part of the mother by not attending proper checks throughout the pregnancy. So now we're going to be looking at how to diagnose cryptic pregnancy twins. And the number one way to diagnose these twins is to do a urine test. Now, you can perform a urine test. Maybe at the early stage, it might not really be positive, but you need to continue to test. All right, once you get a positive urine test, go for a blood test, or even if you are getting a negative urine test, you can also go for a blood pregnancy test, which is believed to be more sensitive than the urine one, and it might just show a positive. So urine test is number one. Number two way to diagnose is a blood test. And the number 3 way to diagnose is an ultrasound scan. Ultrasound scan is very key in diagnosing cryptic pregnancy twins, because if the ultrasound missed it at the early times of your pregnancy, it will not miss it later in that pregnancy. So ultrasound scan is very important in diagnosing cryptic pregnancy twin. And so if you are pregnant, then you need to see your doctor frequently. All right, especially if you're having symptoms that are very, very exaggerated, a bigger than normal baby bump, then you should really see your doctor from time to time and also follow up with ultrasound. Another way also to detect a cryptic pregnancy twin is through the fundal height. Now, if you're following up closely with your healthcare providers, they might be able to see from your fundal height, this is 6 months pregnancy. How come the fundal height is so big? Even if it is a big baby, this is too much. We need to perform more examination to be sure this woman is carrying one baby. So if you are following up with your healthcare providers, you would be able to know that yes, it's a twin pregnancy before you go into labor. So now we're going to be looking at the signs and symptoms of cryptic pregnancy twins. Now, signs and symptoms of pregnancy are usually the same for almost all pregnancies. But one thing that differentiates signs and symptoms in cryptic pregnancy twins or in other twin pregnancy is the fact that the morning sickness and all the other symptoms of pregnancies are more exaggerated. So number 1 signs and symptoms of a cryptic pregnancy twins is an exaggerated or extreme nausea and vomiting. Now, if you discover your nausea and vomiting is too extreme, maybe you're someone that have had the baby before and all of a sudden you're pregnant with this baby and the signs and symptoms are killing you, they are overwhelming, they are so much, you are vomiting non-stop, you're having nausea non-stop, it could be a twin pregnancy. Number 2 is spotting. Now, normally in early pregnancy, you would spot, and that's referred to as implantation bleeding, right? It's just a little form of kind of bleeding that most times you just know there is blood when you wipe. But with cryptic pregnancy, normally you continue to see bleeding monthly that seem like it's your period, but it's not. So with twin pregnancy, you will be getting that spotting. It's one of the signs and symptoms. Now, let me talk to you about myself. When I was pregnant with my twin boys, I noticed that I didn't spot during implantation, but somewhere around the 7th or 8th week, I got spotting. I was so scared. I was thinking maybe it was an early sign of a miscarriage or something. And because at that point, I didn't know it was twin I was carrying. So because of that spotting, we had to go for an ultrasound. And then we're told we're having twin. In fact, the sonographer first queried triplets and asked us to come back after some time to confirm if it was twins or triplets. So that spotting, I felt like it was maybe the second baby that was trying to implant at that point. And so I got that spotting. Or probably the babies were trying to make room for themselves for the fact that there were 2, and then I got that spotting. So with cryptic pregnancy twin, you're going to be getting that spotting, and then it could be unusual compared to maybe a normal single pregnancy spotting. So that is another sign of cryptic pregnancy twin. The third one is bloating. Now, in pregnancy, you get bloating. If you're carrying even one, you get bloating. So if your bloating becomes so severe all the time, it could be that you're carrying a twin, and you should follow up closely with your healthcare provider. Another signs and symptoms of cryptic pregnancy twins is fatigue. Now, fatigue is usually very severe in the later stage of pregnancy, but with twin pregnancy, it is much more severe. So if you're pregnant and then you're getting severe fatigue, but then the scan showed you initially that it was one baby, then you should go for proper check. It could be that it is 2. Another signs and symptoms is a raised HCG level. Now, with twin pregnancy, you get very elevated HCG level, and you discover that sometimes you even get positive pregnancy test very early, way earlier than you would get for a single pregnancy. And that is also one of the reasons your morning sickness is so severe. So a raised HCG level is another sign of cryptic pregnancy twin. Another sign is breast tenderness. So swollen breast, tender breast, painful nipples, these are all signs of pregnancy, and with twin pregnancy it is much more exaggerated. So if you are getting this very severe pain in your breast, tenderness, swelling, and then you were told earlier it was a single pregnancy, please go for check. It could be that it's a twin pregnancy and one is just hiding. Don't worry, they are going to be found. So another signs and symptoms is constipation. Now with pregnancy, constipation is usually one of the cardinal signs. So if you are getting severe constipation, it could be that it's a twin pregnancy. Follow up with your healthcare provider. Other signs and symptoms is cramping. Now severe cramp could be a sign of twin pregnancy, and if you're actually pregnant and the cramp is so severe, then you need to go for checks. It could be that you're carrying two babies and one is just hiding at the back of the other one. So please make sure you go for checks. The other one is weight gain / bigger than normal baby bump. So if you're pregnant and you're just adding weight and then your baby bump is so big, like bigger than it should be at the age of pregnancy that you are, then you should think about twin and go for checkup. Even though the scan must have told you, hey, it was one, no, please make sure you follow up again. It could be that this other baby is just hiding behind brother or sister. So the last signs and symptoms we're going to be looking at now is fetal movement. With twin pregnancy, the movement is more than a single pregnancy. I was pregnant with twin and I can tell you that the movement is so much. They are going like this. One is moving, the other is moving, and so you're just getting serious movement and kicks. So if you notice that the fetal movement is something that's like, it's more than you would get for a single pregnancy, and you suspect that this movement is not consistent with just a single baby, then please make sure you're following up with your healthcare provider closely. It could just be that you're carrying a cryptic pregnancy twin. So from all I've said, you will discover that yes, a twin can actually hide from the eyes of the ultrasound. And so if you were pregnant and you were getting all the symptoms I've mentioned, kindly make sure that you're following up with your healthcare provider closely, because cryptic pregnancy twin does exist. But the difference between this pregnancy and the single cryptic pregnancy in most cases is the fact that they get detected later in the pregnancy. And except you are someone who was not following up with your healthcare provider, you will definitely find out you're having twins before delivery. But if you're not following up closely with your healthcare provider, then you may actually not know until the time of delivery. So thank you for watching. If you've not given this video a thumbs up at this point, please give it a thumbs up and kindly subscribe if you've not done so. Thank you, and I'll see you again in the next video.